continued evidence about all drugs reached with codeine after adenotonsillectomy definition. The August 16, 2012, the Food and Drug Administration is reviewing reports of children who developed certain serious or audit after taking codeine for pain relief after tonsillectomy and or adenotonsillectomy for obstructive sleep apnea syndrome sleep. Application in nursing. The nurse should assist for the presence of somnolence, confusion or difficulty in breathing or unusual news when the child breather should start giving the child codeine.
For years, the American Academy of Pediatrics has warned of the potential dangers of prescribing the painkiller and cough suppressant codeine to children.
But as Terry Okita reports, there's a new study that's found far too many young patients are still being given that drug.
New dad Wesley Johnson asks a lot of questions when his twin boys are prescribed any medication.
Any medicines like that, I think we have a thorough conversation with our doctors about it. Just research as much as possible, and parents just don't want to give our kids anything.
A new study published in the journal Pediatrics finds some emergency room doctors still prescribe codeine, even though guidelines warn it can be dangerous in children.
Absolutely, potentially harmful. Children are definitely different from adults whenever we give them medications.
Codeine is an opiate prescribed for cough and pain. The study found it can help some children, but about a third get no relief, while others can build up toxic amounts, causing excessive sleepiness, difficulty breathing, and in the rarest of cases, death. The FDA warns it can also trigger rare, life-threatening complications after some surgeries. Pediatrician Peter Waldstein says it isn't worth the risk and says there are safer alternatives, especially for a cough.
Good old honey. Honey works, and as far as pain relief, ibuprofen.
Doctors advise for more severe pain, hydrocodone is a safer, more effective option. Johnson says he will steer clear of giving his boys any medication without checking with his doctor first. Terry Okita for CBS News, Los Angeles.
The study can be found in the May issue of Pediatrics. It suggests that in addition to emergency rooms, clinics and hospitals should also reduce the amount of codeine prescribed.
Pros and cons. The pros. A contradiction will be added to restrict codeine use in patients. The content many show children have sleep disorder, breathing are not to be more sensitive to opioids. Use apply in Ecuador. After learning several cases some fatal associated with the administration of codeine in children for the symptomatic treatment of pain.
A new warning tonight about the danger of giving children a commonly used pain reliever. It's been known for years that codeine and children don't mix. Now researchers have uncovered a genetic trait that leads some children to process the drug at a rapid rate, putting them at risk of a life-threatening overdose. Our health specialist Jennifer Tryon is in Toronto with the details. Jen?
Robin, 1 in every 100 Canadian kids are at risk of overdosing on codeine, and it's all because of their genetic makeup. Researchers found 4 recent cases where children died after being treated with medication that had codeine in it. All of the deaths occurred after children had their tonsils out. They received the proper dosage. The problem is they had a duplicate of a gene that's responsible for converting codeine into morphine. That's how codeine works. But the duplicate gene meant their bodies converted too much, leading to an internal overdose. There are genetic tests, but they're expensive and not used in Canada. It's why researchers are now warning hospitals and parents to avoid codeine in children altogether.
Well, 4 cases, 3 coming from the same region of Ontario, must mean that there are hundreds of cases that no one yet found. There is no question that guidelines on a national level should be produced.
Jen, what should parents do if they have children who are facing surgery and need pain relief?
Well, the best thing to do is to ask the hospital if it's still using codeine in kids. Sick Kids Hospital in Toronto, for example, has already banned it. So have hospitals in Europe. So you can use ibuprofens for pain relief instead, but there still are many smaller community hospitals still using codeine in Canada, and it's particularly important to ask if your child has an underlying condition like asthma, because the overload of medication resulted in the inability to breathe in many of these cases that these researchers found. So until there's an outright ban in Canada, you can't be sure it's not being used unless you ask. Robin.
The FDA says pain relief for kids undergoing surgery should not include codeine. I'm Erin White, and this is a Daily RX Minute. Previously, codeine has been given to children for pain relief after a tonsillectomy or adenoidectomy surgery to remove tonsils or adenoids. However, some children with underlying breathing problems have experienced severe side effects, including death. If you see any side effects, call 911. And for additional health news information about this story and others, click the related links below.
Conclusion. Some of the patients we did are in one respiratory depression developed where genetic extensive metabolism, subpatients which normal genotyping result may still be outright.